Hi, Greg here. I teach a course called The Anatomy of Back Pain, and I want to give you just the Coles Notes of what that course is, and hopefully by 2012, early 2012, we'll have it up on the website so that you can actually see the whole thing. But the basic back pain that we see on a very regular basis comes down to a few very common things. Now, if you've seen the DVD on the rehab process, so seeking medical help and all of that stuff, make sure that if you haven't seen it, make sure you see that first. But if you've gone through the process, there's nothing really structurally wrong, but you have this nagging, aching pain that's either bothers you in the morning or getting in and out of the car, whatever it is, then there's a few real basics that come with that. The way your body is designed, the way your pelvis is designed, you have hip flexors in the front that obviously flex your hip, bring your leg up. Then you have muscles in the back of your pelvis, your glutes, that help control what's happening, whether it's turning your legs in and out. And then of course you have the back muscles that are running up your low back. There are two major culprits in low back pain. One of them is your hip flexors. Because we spend so much time sitting, then what it causes is these hip flexors to be tight, so we get into this sort of position like this. And what is very commonly described to me was I have nagging back pain, and it's whenever I get up from sitting, it takes me a while to stand up. Well, what that specifically is your hip flexors are tightened. And because you have back pain, for whatever the reason that the back pain is actually there, your hip flexors will tighten up even more to try and splint the area. The way I always sort of equate it is if we were cavemen or cave people and you broke something or your back was sore, your body's natural reflex should be to immobilize you. So even though this sort of splinting of the muscle causes you pain, it would cause you to move less so that you could your body could repair itself. Well, we don't live in caves anymore, so we have to deal with going to work and all of this stuff, and we have better modalities to deal with this stuff. But what's basically happening, if you're standing here, you're trying to stand up and your back is really sore as you slowly stand up. Once you get to standing, then it starts to feel okay. That's your hip flexors. Your hip flexors are trying to splint the area. Usually when this happens, also the muscle in your glutes, one of the big culprits is called your piriformis. It's this muscle that actually bridges right over that sciatic nerve. So a lot of the people say that I have sciatica. It can be from that. It can be from the muscle. The muscle passes right over the nerve, and the nerve is about the size of a quarter. So if that muscle is with your hip flexors trying to splint as well, it's putting pressure on that nerve. So maybe you're feeling a little bit of sensation. Usually if it's sciatica and it's not disc, and this is usually, you have to go for medical help if you're getting these kind of symptoms to at least understand if it's structurally, if it's something going on with your disc. But if it's not going on with your disc, you can get referred pain down your leg. If it's sciatica, it typically stops at the knee. If it's your disc, oftentimes, if left untreated, will go beyond your knee, down your leg, into your foot, and all that kind of stuff. So you have a little bit of pain down your leg, you know it's not structural, you're having a hard time standing up. This is the splinting mechanism. Now, what are you going to do for it? The two things that you can do are just simple stretches, and you can do them a couple of times a day to at least relieve the problem while you're either waiting to go for therapy or you're waiting for your medical appointment, whatever. The first one is just a simple hip flexor stretch. Now, a hip flexor stretch, you want to be down on one knee, just nice and relaxed, and you're going to push your body forward. You don't want to lean your body forward all the way like this. All you have to do is push forward from here, and you'll feel your hip flexor go tight. You can hold it lightly like that for at least 45 seconds, 45 to 60 seconds, and you shouldn't be pushing so hard that you're thanking yourself for stopping at the end. You should just be able to relax switch sides, and do that 3 or 4 times on each side. Now the next one is what they call a pretzel stretch. Now the pretzel stretch, if you're lying on your back, you cross one leg over like that, reach between your legs and pull. What happens in that position here is actually your piriformis will stretch out a little bit, so it can give you some relief for that pain down the back of your leg, that mild ache down the back of your leg. Okay? If you just do those 2 simple things, you should get a little bit of relief. You can ice, always ice, like restarting the computer for your body. If you have aches or pains, you should ice at the spot that's the most sore. If you're getting, pain lower and your hip flexors are sore and your back is sore, you could consider an ice bath. Get a little bit of advice, make sure that you don't have circulation problems or anything like that, that you can do that. But ice baths are great, just up to the waist, maximum 12 minutes. And lots of people, lots of athletes use this all the time, and you can get a fair amount of relief from that as well. Okay, that's just the Coles Notes. And hopefully, like I say, early 2012, we'll get it up on the website so that you can see the whole program.